Hello, my name is Dayan Siebra and welcome to another video, and today it's a topic that generates a lot of controversy, a lot of discussion, which is anal sex. So regardless of whether you're for or against using the penis to have sex, scroll down in the comments, subscribe to our channel and make sure your bell is activated. It's important for you to receive notifications when there are new videos. And if you don't like the video, please like it right away or dislike it at the end if you don't like it. This like is very important for us to know if you like the content. So let's go. Anal sex is something that generates a lot of controversy, a lot of comments, a lot of discussion, and I sincerely think that these discussions shouldn't happen, but especially not in the way that they do. That is, with aggression, with prejudice, not at all. Do you know why? Because instead of the focus being on debating knowledge about the problem, about the safety of anal sex, about how to be safe, how not to be safe, people are more concerned with judging. Let's stop judging people. Oh, because this one does it. This one, it's not up to us. There are people who say it's wrong. There are people who say it's right. There are people who say it's a sin. There are people who say it's forbidden. There are people who say it's wonderful. Everyone has the right to give their opinion. It's like politics. But not to interfere in other people's choices. Everyone has their own mug and they can do with it what they like. I just don't want you to mess with mine, but I don't care about anyone's mug. I do mind when it's spreading disease. Then it becomes a public health issue. A badly used mug will spread disease. So this video today is for you man, it's for you woman who wants to practice anal sex safely. Once again, I'll repeat it here. Dayan, are you advocating anal sex? I'm not making an apology. I'm saying that if you're going to do it safely. So let's get down to the 6 tips I've put together for you. The first thing seems a bit obvious, right? But people don't always do that, which is to use a condom. We need to go back in time and start talking about condoms more, people. People are turning off because AIDS started to have a certain control, a certain treatment. People, they don't care. And hepatitis, that's when they really don't care. The rectum, or that part of the intestine that comes above the anus, is a region that houses feces, poop. People seem to forget this when they have anal sex. And feces is made up of 50% of, you know what, bacteria. So you can be contaminated if you don't protect yourself. What's more, it's a region that has a lot of vessels. The rectum is a very vascularized region. It's no wonder that when you have a problem with dilation or constipation, a vein comes out of the area, which is the hemorrhoid. So if you're not careful, you can rupture these vessels too, and then bleeding can happen. And when that bleeding happens, a sexually transmitted infection can occur, like syphilis, like AIDS. So you have to use a condom, okay? Secondly, you have to use water-based lubricant. If you have anal sex without lubricating the anus, not just the anus, but the penis, it's usually the penis that's going to be inserted, you can cause a problem. You can lacerate, that is, tear the area. The laceration will hurt, it can bleed and even lead to surgery. So use lubricant. You can never have too much in anal sex. And at this point, I wanted to stop and remember a story that happened to me and tell you about it. Not to me, to a patient I treated. This is a true story, okay? It's a true story, which was the title of this video here. When I was working in the emergency department as a general surgeon, I was on duty at about 2 o'clock in the morning, and I was called, "Dr. Dayan, there's a patient over there who really needs your help." I got there and saw a young woman about 18 years old, young with her family, father, mother, pale white, the color of death, all wrapped up in a sheet, and I asked her what happened. And she cried in panic and looked at me and said, "Doctor, I'm dying of shame." I said, "What happened?" "Doctor, I was having sex with my boyfriend, anal sex, and look what happened." People, they were excited, a young couple, very excited, having anal sex. I think they didn't take care there, they weren't careful. There was no lubrication. In short, his penis lacerated straight. Do you know what happened? The rectum tore inside. And she was bleeding from the rectum, bleeding and losing all her blood. At that very moment, we sent her to the operating room. Do you know what had to be done? The intestine had to be removed. This young woman spent 3 months pooping through her belly through the wall, just like President Bolsonaro did for a while because he was stabbed. Now imagine being stabbed, now a penis. People think that doesn't happen. and then you have to operate again to put the intestine back in. And the scar on the young woman's belly, because apart from the risk to her life, there's also the aesthetic issue. So you have to lubricate, you have to relax, you have to use a condom, you have to do all this. And since I mentioned relaxation, this is the third tip. You need to be relaxed. Guys, the anal muscle is very strong. It locks. When it locks, it's over. There's no one who can make a cup open when it's locked, and when it wants to relax too, there's no one to make it lock. Try yourself at a party at night, not wanting to use a chemical toilet, and if he does, then you're not the one in charge of your life. He's much more powerful than you think. So, it doesn't relax at almost any point in everyday life. It's one of the few muscles that's there all day, contracted. It only relaxes when it's time to poop, and that's about it. My mug himself is fierce. Not everywhere he goes. If I come here, he looks at me as if I'm looking at him like that. But no, I don't want it here at night. Lock it up. So if you're going to have anal sex, you have to relax. How do you relax an anus? I'm gonna say, from my experience as a doctor, that we do a rectal touch. At least I used to do a rectal touch. You have to make a discrete compression on the muscle, push it a little, and insert your finger to do the rectal touch. But you're not going to do this in the middle of a sexual act, standing there with your finger like that. So you're going to stroke there with your finger for around 5 minutes, saying, oh, I'm going to get here so I can do it. And so that nothing goes wrong, ask your partner. If the person is already ready for penetration, you say, go ahead, talk, go. It has to be, unfortunately, people. The fourth tip is to choose the best position. The best position will guarantee more pleasure and will hurt less. And that position is on your side. Of course, there are sexologists on the channel, people who are experts. I hope my friend Katya Damasceno will help me in the comments. Katya, kiss you. You know a lot more about this than most people. Or Tati, if Tati is watching me here, comment, Tati, give us a tip. So the ideal is on your side. It's one of the positions that the doctor also does the rectal exam in. Lying on your side, right? Lie on your side, bend your knee and go for it. But you have to talk to your partner. And the other thing is that anal sex has to be slow. So don't think that if you're thinking of having anal sex that it has to be at the same speed. Some people are like a rooster, right? Guys, come on. So it can't be the same speed as vaginal sex. So anal sex needs to be slower. Once again, if you do it too hard, it can burst, it can hurt, it can cause pain, and it can cause trauma. And the sixth and final tip, but not because it's the sixth and least important, perhaps it should be the first, is the consensus among practitioners. Never think about practicing anal sex like any other sexual practice without talking to your partner, without their consent. Both parties must agree. This even applies to cases where both people want to have sex, but when the time comes, one of them gives up. If one of the people involved says no, it's not no. And you have to respect that, otherwise it could lead to legal problems. That's a crime. Not respecting anything during sex is a crime, whether it's a man or a woman. The important thing, people, is that you have sex the way you want to, as long as it's safe and agreeable to both parties. Sex doesn't have to be taboo, it doesn't have to be judged, sex has to be guided. I hope you don't judge me for making this video. This video is not a video encouraging anal sex in any way, shape or form. This video is for people who have anal sex to protect themselves and do it in the best possible way. There's no point in crossing our arms, omitting ourselves and, oh, I'm not going to talk about it because it's not nice. No, you know, I don't do that kind of thing here on the channel. And enjoy it, because the ugliest thing is to watch a video like this and not share it with your WhatsApp groups, especially groups that have homosexuals, especially groups that have people who like to have anal sex. Send it there and see what people say, okay? Big hug, live healthy, live with passion and with God in your heart. Bye, guys.